Doctors of Reddit. What is the strangest thing a patient said they had that actually turned out to be true? Story 1, obligatory, not a doctor, but a medical student. On my mental health placement, there was a guy I saw on a home visit who was convinced his neighbor was trying to kill him. This guy had a history of mental health problems, and the doctors were sure he was psychotic, and all of this was in his head. However, a few days later, the doctor went round for another home visit and found his neighbor trying to climb through the window with an AXC. The poor man wasn't psychotic at all. His neighbor was actually trying to murder him, and everyone thought he was just mad. Story 2, an OB/GYN resident. This one still freaks me out, as a med student had a superbly kind and funny pregnant patient with mild hypertension, IVF twin pregnancies, conceived overseas, little older than usual, slightly overweight, previous C-section. Nothing really remarkable, just a few small risk factors altogether. She came to high-risk clinic, and the fetal heart tracing was a bit too quiet. Not scary, just not great. Maternal fetal medicine subspecialist doctor said she should go for delivery. The lady and I were chatting. She was from the same city as my then girlfriend. She had a great sense of humor, took the delivery news like a champ. Jokingly said, "Okay, but don't let me die. I want to meet your girlfriend after all this." We said goodbye. The nurse and I smiled and wished her well. The attending then said, "I don't like this. This is the kind of patient that smiles, looks good, then dies." Nurse and medical student me both thought he was crazy. She had a textbook, uncomplicated C-section, moved to recovery. 1 hour later, suddenly lost her pulse with essentially no warning and died of an amniotic fluid embolism. Amniotic fluid embolism, unpredictable, unpreventable, occurs in 1 out of every 20,000 to 50,000 births. I can still remember how she looked waving goodbye to us. I've seen a lot of people in a lot of different fields die, but this one still hurts my heart today. Story 3, worked on the ambulances for a stint when I was fresh out of uni. One day, I was transferring to another county with an elderly patient with such severe dementia, he didn't remember his own wife, or even his name. The whole ride there, he was happily chatting away, telling me that he was an ex-international footballer, about his big victories, and how he owned a business with David Beckham, mixed in with other psychedelic nonsense. I just kept asking him questions to keep him occupied and chatting, but in my head I was thinking it was just a funny side effect of his dementia. So we arrive at the new hospital, and his lovely wife is waiting there. Me and my crewmate transferred him to his hospital bed, and his wife shook our hands and thanked us profusely for being so kind with him. She said, "I know he's a bit of a handful. Did he say much on the way?" And I said yes, he was telling us about being an international footballer and that he owned a business with David Beckham. She scoffs and says, "You told these nice people you were David's business partner." Only met him a couple of times. When I asked how he knew him, she explained that he had indeed been an international football player and was well known for heading the ball. In fact, the doctors thought that's why he developed the dementia. I was so shocked, they'll never forget him. Story 4, a patient walked in the clinic with a complaint of fever. I noticed his hands were very yellow. He did have a history of alcoholism, but no other signs. I told him his hands suggest he is jaundiced and will need tests. He laughed and said, "Oh no, I just dusted my hand with turmeric." Story 5, I had a bone replacement surgery, upper third of the tibia, and it was fixed in place to heal with a titanium plaque and screws. One day the plaque broke, and I went to the ER and told the doctor that I had a broken piece of titanium, and he called it bullshit. His face, after seeing the x-ray with the plaque separated in 2 pieces, was priceless. Story 6, not a doctor. Friend's son, aged 2, came home from daycare, said he had stuck an acorn up his nose. Mom looked. No acorn. Around 2.5, boy develops chronic throat and sinus infections, has 8 courses of antibiotics in a year. Age 4, boy is sent for tonsillectomy. Surgeon comes out of theater, shows mom a moldy, rotten acorn. Turns out he did put an acorn up his nose. They left tonsils, and boy ridiculously healthy ever since. Story 7, patient here. This is a case where the doctor called bullshit on what I had, broke my arm once. There was a huge waiting time at local hospital, so I decided to go to another hospital the next morning. I slept really badly, but managed to have like 3 to 4 hours of sleep. Instead of waiting the whole night awake in a waiting room, when I explained what happened to the doctor, she said it was not broken because if it was, I would never be able to sleep with it. So I get used to the idea I did not break my arm. I stay there for the scans because it was swelled in weight. The doctor came back with 2 pills of morphine saying I had incredible pain tolerance and that my arm broke at 3 places. She then explained I needed a surgery the same day, and they're making place for it on the agenda. I can still remember her face when explaining to me the procedures of the surgery, knowing she told me earlier it was not possible. Story 8, not a doctor, but a nurse, had a patient come in with a toothpick in his penis, refused to tell me how it got in there, insisting he was picking his teeth, and it fell in. Story 9, my daughter had a fall on the trampoline when she was 3. She let out this really weird scream, then went pale, quiet, and sweaty, and wouldn't let us touch her arm. We only live 5 minutes from the hospital, so I put her in the car and drove there. She slept in the car. We get to the hospital and check in, and she's found her second wind. The triage nurse rolled her eyes at me when I asked for an x-ray, but ordered one anyway. At this point, my daughter was literally pirouetting around the waiting room. I was starting to doubt myself. Even the x-ray technician was laughing at us. About 5 minutes after the x-ray is taken, a very red-faced triage nurse runs out to the waiting room and firmly tells me to stop my daughter from dancing. She's broken her arm, and they don't know if she will need surgery or not. She didn't need surgery in the end, but spent 6 weeks in a plaster cast. It turns out she's and has a great pain threshold. Love her. Story 10, nurse. I had a patient in her late 70s talk about how her mom was upstairs and died last night. I used to work neuro, and so confused old people was her gig. So I just listened like, wow, okay, and did my job. I told another staff member about how she wouldn't stop talking about her mom being upstairs and dying last night. And they said it's true, her 98-year-old mom died in our ICU last night. I checked the roll in the morgue, and lo and behold, her mom's name was on it. Well, okay, then. Story 11, not a doctor, but a combat medic in the Army, had a private heat stroke on me, and on his journeys back and forth between consciousness, he stayed in my butthole hurt, but feel really good too in a slurred outburst. I looked at him, trying not to burst out laughing. Why, yes, private, there's a rectal thermometer in no square. Story 12, not a doctor, but once had a patient claim to be a former member of a very famous sports team. Googled it, and it was true. Poor guy was kind of unknown. He made the team, and then quit to do various illnesses very soon after. Story 13, patient here. I broke the same rib 11 times over the course of 3 years, but the doctor often wouldn't even order an x-ray. She just said it wasn't healing right. Give it time. I tell her there's something else going on. She dismisses me. Finally, after the 11th time, she says, fine, well, x-ray. X-ray shows a mass. Mass is biopsied. I have a tumor. The tumor was weakening the bone to the point that it broke when I reached into an upper cabinet for the sugar. Had that bad boy, named him Adam, removed in 2018. 1 week hospital stay. Worst surgery I can imagine. And now I'm doing great. Story 14, not a doctor, but a patient. In January this year, the side of my face grew bigger and bigger, and I was in extreme pain. I go to my GP and tell him looks like mumps, don't you think? But he brushes it off, saying I got my vaccines. He sends me to the ER because he does not know what I have and how to treat it. After 5 hours in the ER, they finally get my blood tested for the mumps. Turns out you can still have the mumps even though you're vaccinated. Story 15, 2 stories, both of which were in the patient. And when I was 11, my brothers were bullying me. So I rode away on my bike really fast, went head over turkey over a log, and decided that to teach my brother the lesson, I'd go all in. So I cried and cried. When my mom got home, she said my arm was probably broken and did all the first aid stuff, rest ice compression elevation, and put me in a triangle bandage. Go to doctors, with me thinking, wow, she's going to be super mad when she realizes nothing's wrong. Nope, it was fracture, got a cast and everything, it never even hurt. So I guess it's a story of, I'm glad someone bought my bullshit story because despite lack of pain, I was the one who was wrong. Some people in my family have no immunity to chickenpox. I've had it 4 times, my brother 5 times. Vaccine doesn't work on us. But every time we tell someone, whether it be a doctor or just a family member, when explaining why I can't see their chickenpoxy nephew because I could get chickenpox again, nobody believes me. One doctor didn't even believe me after he tested me. Just kept saying, well, this can't be right. I mean, he was probably just surprised, but I still didn't go back to that doctor. Story 16, inpatient psych ward. When I was a medical student, we admitted a guy who was having psychotic delusions. He lived in a holler, small valley between 2 mountains. For weeks, he had been absolutely preoccupied by this idea that the mountain was going to fall on his house. He would spend days at a time, without sleep, finding rocks, branches, and other junk and piling them up behind his house because the mountain's going to fall down on my house. I guess this wasn't the first time this happened, because the family brought him in saying he was off his meds, working himself to death to build a pile of junk behind his house. He's admitted for a week or 2, goes to group therapy, has his meds adjusted, and he's doing well. We decide he's been tuned up and ready to be discharged. His family comes to pick him up, but they have this grim look on their faces. We're bringing him back to the hotel. Yesterday, there was a landslide. It destroyed the house. Story 17, not a doctor, but the patient. I have a long history of getting hurt in stupid ways, and one point after I moved to Europe, I dislocated my shoulder for the millionth time. I told the doctor that it was dislocated. He said I would not be talking to him in that common manner if I had moved my big jacket aside, and woe and behold, if it was right out of the socket. I have a ridiculously high pain tolerance, and am used to it. Edit, I haven't lied to woe, and behold is not a real phrase, and now people are mentioning it on other comment threads. am kicking Jason's next time I see him. Anyways, please ignore the explanation I made earlier about it, because apparently it's all horse, and I'm sad about it, because I thought I knew something cool about the English language. Never trust your friends' kids. Edit 2, it exists. Whoa, and behold is a thing. Maybe not a common this, but it's real. Story 18, not a doctor, but my mom's a nurse, so close enough. 1 year during college, the day before Easter break, I dislocated my knee. This was a year when Easter was in early April, meaning I injured myself on April 1st. I was oddly calm. Everyone was panicking, and someone had to take charge. So I sent people to get ice, and someone else to go get my car keys and drive me to the ER. Bro college me did not want to pay for a wee-woo wagon. Someone who didn't follow directions freaked and called an ambulance anyway. During this time, I figured I would be a responsible adult and call my mom at work and let her know I would not be able to drive back home for break that day. But maybe the next spoiler alert, no, of course, she did not believe me, especially since there was no panic in my voice. As I was trying to tell her that my kneecap was on the side of my leg and definitely shouldn't be there, the EMTs showed up. One guy took the phone from me and said, "Ma'am, with all due respect, your daughter's knee needs to be put back into place, and we're going to take her to the ER to do that, of course." I refused the ambulance ride at first, but after realizing I wouldn't be able to get into a regular car without immense pain, I let the EMTs take me. Multiple painkillers later, I felt much better about my decision. I ended up in the ER by myself. Everyone had classes, I guess, or was already gone. I don't really know. And at one point, I texted my mom a picture to prove that my kneecap was not in the right place. Doctors nicely put that thing back where it came from, gave me more drugs and crutches. Pro tip, don't use them on while on painkillers, and sent me on my way. Thankfully, a friend's mom lived close by and dropped me back off at my dorm, of which I lived on the second floor without an elevator. Somehow, I stumbled up those stairs like a champ, made it to my room, and passed out on my bed until my parents were able to pick me up and take me home, a 3-hour drive one way. TLDR, dislocated my knee on April Fool's Day, and my mom thought it was a joke. Story 19, I dislocated my knee for the second time. When I was about 18, simply sliding into a booth at a bar, screamed at the sudden pain, and one of my friends called an ambulance. Only problem was that it had popped back in by the time the ambulance got there. They decided that I couldn't possibly have dislocated it. Fast forward about 9 years, when after many more dislocations of my knees, shoulders, and wrists, and finally a cancer scare because my suddenly changed shape, they discovered that my ligaments just weren't holding me together properly. It was my physiotherapist that advised I asked to be referred for an Ehlers-Danlos diagnosis. And when I asked, I was told you can't possibly have that. Your skin springs back straight away. I insisted, and about 6 months later, I was finally referred to a rheumatologist. Spoiler alert, I have Ehlers-Danlos. Story 20, I was the patient in this scenario, but my boyfriend came home to find me unconscious and covered in vomit. The only words I could get out were, "I've had a stroke," on repeat. Doctors dismissed it for nearly 48 hours before someone with common sense gave me a scan, and I had a bleed on both sides of my brain. Wasn't believed because I was 22 and looked fine. Story 21, I tore the ligaments in my knee when I was 12, and the doctor had a difficult time getting the stitches out. One broke, and he decided to leave it under my skin, telling my parents it would dissolve. When I was 16, I banged my knee against something, and out popped the end of the stitch. I went to the doctor to get it removed. You could see a long, curly blue thing under my skin. I insisted this was the remaining stitches. My doctor just thought it was a vein. She froze a small area around the protruding stitch and pulled on it. She pulled out 2 or 3 inches of curly stitching. She held it up, looking shocked, and said, "I have to go show the other doctors this," and left the room. Story 22, had a larger patient complaining of abdominal wall pain ever since they were head-butted by a goat. CT scans never identified anything. On a whim, got an ultrasound and saw this little cyst thing the size of a pea right where they were hurting. Told them no guarantees, but I'd be willing to cut it out to see if it helps. Ended up cutting out an ellipse of tissue where the cyst thing was, and all their pain was gone. Story 23, patient complained of movement and itching in lower left edentulous mandible. While in my chair, he reached up and scratched a hole through his gingiva and was bleeding profusely trying to get to them and show me the wriggling things. I'm sad to say that I suggested a psych evaluation, but to be fair, I did refer to oral surgeon just in case. Even made a personal phone call to ensure warm handoff and rapid response. They uncovered some kind of parasitic insects. He healed, and I listen to patients no matter how bizarre sounding. They feel something. Story 24, I was the patient in this situation. In 7th grade, I was riding scooters with my little brother, and I fell off when I hit a pothole in Michigan. And when I fell, I put my arms out in front of me. I felt the worst pain in my right arm, right from my funny bone. I have never screamed so loud, and I still had to walk home. My brother was freaked out, and I kept telling him I broke my funny bone. I broke my funny bone, we finally get home. And I tell my mom the same thing. She's a nurse BTW. She didn't believe me and didn't even check my arm. I sat on our sofa for about 4 hours crying and saying I was in pain before she took me to the doctor. They took an x-ray, and sure enough, I broke my ulna. My mom never even said sorry for not believing me, and I had to wear a cast and everything, plus I had to go through months of, well, it wasn't very funny, was it? Story 25, occupational therapist here. I was gathering a social history on an elderly patient. Asked who she lives with. She told me she lives with her 6 dogs and 200,000 bees. I was like, yep, this lady has post-operative delirium. Called her son to get the real social history. He was like, yeah, she's a beekeeper and she adopts old dogs. Story 26, patient here. I was at a festival a couple months ago when I got knocked about in a mosh and went down hard before someone yanked me out. I went to the med tent 3 different times because something in my knee didn't feel right, and every single time was turned away and told I just had a bruised knee and that all they could do was give me ibuprofen and an ace bandage after about 6 hours of walking on it and having it collapse out on me repeatedly. I finally called it and went home. I convinced a mate to drive me to ED the next morning, free hospo visit, because my country isn't stupid, and walked in by myself. Sat there for a couple hours before I could see someone, and then when I did, I had to push to get an x-ray and an MRI, saying I thought I tore my ACL. Doc told me I wouldn't been able to walk from the car into ED, let alone the 6 hours the day before. Results come in, and turns out I've done the terrible triad. SL, MCL, and PCL. So that's major surgery and a 6 to 9 month recovery time. So, yeah, you ED doc and OMBO volunteers. Story 27, am not a doctor. Not even the patient in this story, but the coworker of the patient. A few years ago, my coworker wasn't feeling well, just general achy malaise, and he had red splotches on his face. So he was telling me and another coworker that he had a doctor appointment. At lunch, because yesterday he just didn't feel good when he got home from work as I described. Suddenly, out of nowhere, I asked him if Head ever had the chicken pox. The red splotches didn't look like classic pimple-like red spots, but I'd been reading a book and one of the characters had it, and it just popped out of my mouth. He said he didn't think Head had it as a kid. Lunch rolls around, he goes to his appointment, and I get a phone call about 40 minutes later. The coworker is sitting in the exam room. Doctor had just examined him and said he had something, but he wasn't sure what. So coworker mentions what I said about the chicken pox. Doctor looks at him and says, that must be one very smart lady, because that's exactly what you have. So that was my first and only diagnosis, and only because of character in my book. Story 28, obligatory, not a doctor, but this is my story. My uncle got diagnosed with genetic hemochromatosis. After the doctors were examining why he had liver damage for no obvious reason, I was told to get checked, along with all other close genetic relatives. When I asked my doctor about it, she gave me the OO face and wrote me up a referral to a geneticist. We joked about maybe needing to do some good old-fashioned bloodletting. This is seriously the treatment for hemochromatosis. It's caused by an abundance of iron in the blood, so draining the blood once a month or so treats it effectively. Got to the geneticist and told him what I was there for. He, too, gave me the OO face and went over my family history, told me how extremely unlikely it was, how had never seen it, yada yada. Took him forever to find a test kit for it. Test came back. Turns out I don't have it by pure luck. I'm a genetic carrier. Only one of the 2 required genes. Geneticist looked at me when he got my results and just shook his head. You were right to be worried. I'm amazed. Edit for clarity added info. People are asking me about genetic status. There are 3 separate genes, 2 of which are interrelated and may be lumped together depending on your genetic testing type that carry the virus. You need 2 copies of any single gene to have a disease, as this is a recessive linked disease. If you only have a single copy, you're a carrier, which does place any genetic relatives of yours at risk. The disease is rare for a reason. Requiring 2 copies makes it difficult to catch. A significantly higher percentage of the population are carriers, even though the disease is rare. Around 15 of those with Scottish-Irish ancestry will have one of the 3 genes. Others are linked to other genetic backgrounds. Generally, the disease is much more dangerous in men than women. Men with the disease begin iron buildup early in life that can cause severe liver damage, heart damage, and other related circulatory problems, with symptoms visible as early as late 20s to 30s. As women experiencing menstrual cycles typically bleed enough to keep their iron levels lower, the disease rarely has any effect on them until postmenopause, when it can build up over the next 20 to 30 years enough to cause damage very late in life. If you think you could have it because of a genetic test or known damage, talk to a doctor and get screened properly. Commercial at-home tests are less reliable than pharmaceutical-grade blood screenings. They can point you at a possibility, but not confirm it. Story 29 patient told me her head felt funny inside. She was intermittently confused. Her family thought she was just bullshitting to get some attention. One head CT later, and she's got a big, off-type bleed going on. Story 30, I am a medical provider. And this one happened to me. While still in training, had a sore throat. Nothing miserable, but like 2 to 310 annoying. Figured it would go away. It didn't. 1 week turn into two turned into an entire clinical rotation. After about 8 weeks, I convinced myself this low, simmering sore throat was probably thyroid cancer. I didn't have any thyroid symptoms, like at all. No constipation or diarrhea, hot or cold intolerance, weight changes, fatigue, heart palpitations, skin, hair, or nail changes, just a sore throat. Soon I started palpating what I was convinced was a lump when I swallowed. Had my attendings feel as well. They all told me I was a stupid student who thought he had all the ailments he was reading about in textbooks. Another couple weeks go by before I schedule my own ENT appointment. I tell the ENT my hypothesis on thyroid cancer. He puts a scope down my nose into my throat. Tries to convince me it's GERD. I tell him I can eat a bowl of habaneros. Wash down with a pot of coffee and orange juice without thinking twice. He starts writing a script for omeprazole, telling me to follow up in 3 to 4 weeks, and we'll see how well the PPI took care of my GERD. I flat out tell him, I don't have GERD. If you're not going to US my neck, you'll find another ENT who will. He was clearly upset with me for shitting on his manicure morning schedule. They will the ultrasound and begrudgingly goops up my neck and starts looking 30 seconds. That's all it took. He says, looks like you're right. Your thyroid is chock full of microcalcifications. This is a telltale sign of papillary thyroid cancer. I need you to have a biopsy tomorrow. Did the biopsy, came back malignant. Had that hitchhiker removed the day after Christmas 8 years ago. Surgeon said it was the size of a golf ball and was nearly completely hidden by my collarbone. So that's why I was the only one who could feel it. It would hit the clavicle when I swallowed, but nobody could palpate the mass below the clavicle. Went back to school 3 days later for the first day of surgical rotation. First case I ever scrubbed into was a thyroidectomy for cancer. Had to flip a coin with another student who was going to stiff me on this opportunity, despite fresh sutures in my neck. That was wild to see what had just happened to me 72 hours prior. Edited for spelling. Story 31, sorry, another one from me. When my son was 3, he became unwell over the space of a week. Tired, drinking more, bedwetting, challenging behavior. I took him to the GP and said that I was worried it could be a UTI or type 1 diabetes. I knew they would want a urine sample, but the only bottle I had at home was a small Coke bottle. I washed it thoroughly, and he weed in it. When we got to the doctor's, it came up with massive amount of sugar in his wee. The GP sanctimoniously lectured me about how I should have used a proper sample bottle. He gave me a sterile one, and I took my son to the toilet. He was able to wee on demand at that point, as he was drinking so much. Shock horror, there was a massive amount of sugar in it again. GP mumbled an apology, and after a stay in hospital, our journey with type 1 diabetes in a 3-year-old began. Story 32, my husband was previously diagnosed by another doctor, but when we moved to another state, his new practitioner didn't believe him that the veins in one of his were knotted during the first appointment. My husband explained in detail all the studies, tests, and treatment plan he's done, even signed a release form to get records. Husband shows the practitioner what he's taking and asks for refills and referrals. The practitioner says he'll do everything request, but fill the Norco script because he wants to review the records at first once he gets them. My husband has explained the pain to me, that it is like getting kicked in all the time with worse flare-ups. He's understandably frustrated that he's out of the one medication that helps and can't get a refill. The husband tells the practitioner to you can feel the knotted veins, pulls down his pants and whips out his junk. The practitioner agrees and pales when he feels the knot. Prescription written same day. Records were received a few weeks later. Story 33, my mom used to work as a nurse in inner city Chicago. She told me a story that some guy came in saying he had injected into his leg. He wasn't lying. He literally injected liquid into his leg to get himself sick. A second story is that a homeless lady came in for some reason that I don't remember. When they were giving her a bath, some white and soggy lump was found in the tub. The lady said, "Oh, that's my fry." She had been stuffing them into her vagina to store to eat later. Story 34, nurse here. So I was doing my night shift in ER, and it was fairly calm. A guy walked in holding his crotch, and he had a lot of clothes around his waist. He asked for a male doctor. There was a female doctor on call, and he refused to see her. I sent a male colleague to assess him. As soon as he was done with the assessment, he peeked from inside the curtain, pale. Apparently his wife found out that this guy was cheating on her and cut across the shaft of his penis while he was getting into bed. Long story short, he was bleeding badly and had to take him in for emergency surgery. He survived, not the marriage though. Story 35, not a doc. My mops was complaining that she thought my pops was losing his marbles, not replying when spoken to, etc. Made some doctor's appointments. Finally decided to check his hearing. By golly, an Asian beetle had crawled in his ear, gotten all gunked up with earwax, causing his hearing to decline. Pops is still alive and kicking, even replying to her when he feels like it. Story 36, not a DR. But in 2017, I crashed a four-wheeler at 40 miles per hour. It rolled over with me still on it, crushing me into the rocks and dirt. I had a friend take me to the ER as I was passing out. They paged every DR in there, at least 10 people standing around me on a bed thing while I was barely conscious. They even called the priest guy to pray with me. I remember having all my clothes cut off, x-rays, CAT scans, you name it. I started to come to more since I was laying down, and one doctor came over. We've seen pics of your ATV and your helmet, and I don't know how you aren't dead. And even more amazingly, you didn't break a single bone. You just got blunt force tissue damage on your left side and cartilage damage in your ribs. We'll keep you overnight for internal bleeding observation and probably release you tomorrow. I stayed overnight, and there was no internal bleeding. I walked out the next day on my own 2 feet. Don't get me wrong, though, I had a lot of bruising on my left side, and parts of my skin were darn near black. It took 3 months to recover, and my ribs are still sore 2 years later. My full-face helmet, neck brace, and my ATV's cargo box saved my life. I'd be dead if not for those 3 factors. So, the amazing thing no one believes is I had an ATV crash that would normally be fatal, and I walked away with no broken bones. Story 37, not my patient, but a crazy story nevertheless. A patient was asked what his job was, and he told that he was a chainsaw juggler and just came back from performing to Kim Jong-il. That was indeed true, but unbelievable enough that he was, though, psychotic and committed until someone actually checked the story out. There are several articles available, but in Finnish. Story 38, I was an intern in the busiest ER in the U.S. and naive. Older man came in with belly pain. He said he'd been drinking and messing around with some random woman and had passed out. He woke with belly pain and told me I bet she put something in there. I could feel a mass in the lower abdomen, but doubted anyone could insert something into his rectum without waking even a drunk man. X-ray showed a coat hanger without the hook, one of those metal kind that is one long, smooth arc and covered in padding and wrapped with silk or similar material. I say I was naive because I believe him when he said he didn't know. He clearly put it there. There was no woman. I have since removed dozens of things from people's backsides that cost him several hours of work up and waiting. I think we all felt his belly and pushed on that thing. Story 39, paramedic here, and not my patient, but from another ambulance yesterday. It was a boy, I think about 12 years old, who believed broke his arm by throwing a ball because he heard something in his arm while throwing, and then it hurt. However, he just sat in the school's gym without a great deal of pain and jumped into the ambulance by himself. Even the trauma check was allegedly unsuspicious. They put his arm in a SAM splint and brought him to the accident clinic. The team of the ambulance later asked in the hospital if the arm was broken or not, because they didn't really believe him. Turns out it was broken. Story 40, obligatory, not a doctor, but I remember when I was really young, like 4 or 5, for whatever reason, I put MMS, just regular ones, up my nose, because I don't know, kids are idiots. Some of them got accidentally stuck because they were too far back. Well, I was with my grandmother at the time and mentioned that they were stuck, and she freaked and took me to the ER, but by the time I actually got seen by a doctor, I guess the chocolate had melted because of my body heat, and the doctor didn't believe my grandmother because there was nothing obvious there. But finally, he agreed to use a swab to make sure, and when he pulled the swab out, it was covered in chocolate, and my grandmother was vindicated. Story 41, not a doctor. My appendix had burst, and I waited the next morning to go to the hospital. They dismissed me pretty much right away because I was laughing and joking around. After a couple HRS of waiting, I had an ultrasound, and the lady said she couldn't find my appendix, so that couldn't be the issue. Makes sense, right? So she tried another type of ultrasound and found it dropped below my ovary before it burst. So they quickly gowned me and started pumping pain meds into me. Then, when they rushed to get the OR ready, I was put on the gurney and was getting wheeled in. I was still happy and joking around because I was just ready to get it out and just nervous about it all. So the doctors double-checked that I in fact had a burst appendix because I should have been in a lot more pain. Story 42, emergency doc here. I once had a woman come in after visiting her psychic. She went because she had been feeling just generally ill, nothing specific. The psychic used some tarot cards and then told her that her dead grandmother was trying to warn her that she had Lyme disease. I totally doubted it, but you'd better believe I ordered the test just in case. The next day, the test came back and she had it. Story 43, in the patient in the story. But it seems like that's happening in the thread. So while in college, I felt absolutely awful for a few days and my lymph nodes are super swollen. So I take myself to the health center. They told me it must be a sinus infection and sent me on my way. The next day, I couldn't even keep a teaspoon of water down and could barely get out of bed. I called a friend to take me to urgent care, where they pretty quickly determined I had the mumps despite being vaccinated. I had to notify my school and the health center. The doctor there did not believe me or the diagnosis, so they made me come back in, and oh whoops, it is the mumps. Glad they made me go expose more people.